All right. Welcome back again to Anatomy 1, everybody. And we will continue our discussion of the lower limb by talking about the medial and posterior regions of the thigh. Okay, so in today's lesson, we'll talk about the medial thigh, and then we'll go on to discuss the posterior thigh. Now, in each of these regions, we shall be talking about the muscles, as well as the blood vessels that supply the muscle and the nerves that innervate those muscles. And then we shall talk about this very important plexus that, just like the brachial plexus in the upper limb, is going to supply all of the muscles and skin cutaneous innervation of the lower limb. And this plexus is called the lumbosacral plexus. Okay, and so let's go on and talk about the medial thigh now. Now, for the medial thigh, we have muscles, blood vessels, and nerves. So let's get on to muscles first. Okay, so the medial compartment of the thigh is also called the adductor compartment of the thigh, simply because of the fact that all of these muscles help adduct the hip joint in some way. And therefore, most of the muscles in this component is going to be named adductors. Okay, so you have this adductor longus right here. And then you have the adductor brevis over here. Now, the adductor longus is going to be the most anterior muscle of all of the three adductors. And then after you cut it out, okay, you cut it out and reflect it to either side, you will have the adductor brevis that is superior. And then you have this huge muscle over here, which is the adductor longus. Okay, and the most medial adductor, but it isn't named adductor, okay, of the thigh is actually this muscle right here, the most medial one, that is called the gracilis muscle. So those four, the gracilis, the adductor longus, adductor brevis, and adductor magnus, they make up the medial compartment of the thigh. And now the medial compartment of the thigh, they are all contains muscles that are all innervated by the obturator nerve. Okay, and there is a little bit of a caveat with that, is that the adductor longus, the adductor magnus muscle over here, because it's so big, it contains two distinct parts. Okay, one part is more anterior and is going to be innervated by the obturator nerve, just like the adductor brevis and adductor longus. However, the part on the posterior side, okay, due to its close proximity to the posterior compartment, is going to be innervated by the tibial nerve belonging to the sciatic nerve, just like in the posterior compartment of the thigh. Okay, so now this is the thing that we're talking about. Just like every time before, I will not go through every single one of this, but I will focus on the things that are actually important for you guys to know. So now all of these muscles, they're all adductors, okay? Adductor longus, brevis, magnus, okay? Now, just like everything, okay, and the gracilis as well, and just like their name suggests, okay, those adductors are all muscles that adducts the thigh, okay, adducts and medially rotate at hip joint, basically, okay. So they are all going to be innervated by obturator nerve, obturator nerve, obturator nerve, obturator nerve, except for the hamstring part, which is the posterior part of the adductor magnus, which is innervated by the sciatic nerve, or the tibial division of the sciatic nerve, basically. All right, so the blood supply of the medial thigh is going to be the profunda femoris artery. Remember, guys, when we talk about the femoral artery, we said that the femoral artery passes through the thigh, but actually doesn't really supply the muscles in the thigh region all that much, okay? But it gives off this huge branch, which is this one here. This is the femoral artery, see? And this one is the branch that goes out, this huge branch over here that runs through here and has all of these branches, okay? The muscular branches, the perforating branches, the lateral circumflex femoral artery branch, and that is the deep artery of the thigh, or the profunda femoris artery. And the profunda femoris artery is going to be the one that is going to supply the medial thigh as well. Okay, so these are all the branches that we have already talked about when we go over the profunda femoris artery before. So let's not talk about it now. All right, the profunda femoris vein is the main vein that receives tributaries that correspond to the branches of the deep femoral artery, and it drains into the femoral vein just like the deep femoral artery is going to be branching out from the femoral artery. So deep femoral vein, here it is, okay? And just like in the deep femoral artery, you have these branches here, okay? The circumflex branches that is going to supply the proximal part, okay? The proximal part of the femur over here, as well as like this area right here near the neck of the femur. Okay, we have talked about the artery that accompanies this artery before, and its significance in supplying the blood to the head of the femur through the neck. Okay, so you need to understand that. Okay, but now for in the veins, you just need to know that the deep femoral vein is going to be the one that drains blood from all this region right here, and it's going to be getting back and join the femoral vein right here. Okay, all right. Okay, so now let's talk about the obturator artery really quick. The obturator artery, which you can see a little bit of it here, okay, it is actually a branch of the internal iliac artery. So where is the internal iliac artery supposed to be? Right here, you have the external iliac, right? Now, over here, you have the common iliac going down to become the external iliac. But then the common iliac is going to have to branch out one more over here that goes into the more genitalia region right over here, the pelvic cavity. Okay, this one is called the internal iliac artery. And from that internal iliac artery, the obturator artery is going to have its origin. And the reason why it is called the obturator artery is that it has to pass through this foramen on its way down to the thigh. Which foramen is that? The obturator foramen. That's why it's called the obturator artery. Now, on entering the thigh, it is going to be divided into two branches, okay, the medial and lateral branches. And these guys pass around the margin of the outer surface of the obturator membrane and gives off muscular branches and an articular branch to the hip joint, okay? So all of these guys, this guy is going to give off a branch to the hip joint right here, as well as some of the muscles right here, okay? All right, so now the obturator vein is the vena comitante, aka the vein that is going to run parallel to the obturator artery. Okay, so the obturator vein will receive tributaries that correspond to the branches of the artery. Okay, and it drains into the internal iliac vein, just like the obturator artery is going to be a branch of the internal iliac artery. Now, the nerves of the medial thigh, the most important nerve of the medial thigh that controls all of the muscles of the medial thigh, all the adductors and the gracilis, what is it? Obturator nerve. Very nice. Reason why it's called obturator nerve is what? It passes through the obturator foramen with the obturator artery and the obturator vein. That's why you call it the obturator nerve, okay? Because it needs to pass through that obturator foramen. So now, obturator nerve, when it goes over to the thigh, something very interesting happens. It has two branches, okay? Divides in two branches. The anterior branch right here and the posterior branch right here. And look, these two branches kind of forms two legs, okay, of a rider, of a horse rider, if you will. Wee, a horse rider. There's a cowboy. There we go. Woo. And these two branches kind of just go right above the top, okay, right above the top of this muscle right here, the adductor brevis muscle. So it's kind of like the obturator nerve is going to ride on top of this adductor brevis muscle. That is always the image that they show us in med school. Okay, that is always the image. But the more important thing that you need to know is that the obturator nerve is the one that will innervate what? Gracilis, the adductor longus, adductor brevis, and adductor magnus. Okay, very important that you guys understand that. Okay. Right, and all of that is what we have seen before. Okay, and let's talk about a little bit about cutaneous nerves, okay? So we have three cutaneous nerves that always help with the medial thigh innervation of skin sensations, okay? And those three nerves are going to be ilioinguinal nerve, which is a very, very small region over here. The nerve that only supplies this very, very small region, ilioinguinal nerve, right? And then you have the obturator nerve that is going to supply this part right here. And then finally, the posterior branch of the medial cutaneous nerve of the thigh is going to supply the lower third. Okay. All right. Okay. Let's talk about posterior thigh now. So the posterior thigh, there's some muscles that we need to know, as well as the blood vessels and the nerves that supply these muscles, just like every time that we have seen on another region of the body before. So what are the muscles of the posterior thigh? Posterior thigh is going to be pretty easy because really there are only 3 muscles in this compartment. Now the posterior thigh will contain this muscle here on the lateral side, that is the biceps femoris, as well as 2 muscles on the medial side that are the semitendinosus and semimembranosus. So where are these muscles? Okay, and what does it look like? This is more of a medial side, and this is the lateral side, right? So the biceps femoris is going to be this muscle here that runs down. And there are 2 heads. There is this long head that is more posterior, okay? And the short head here that is more anterior, okay? And now on the medial side, you have 2 more muscles. The semitendinosus right here, okay? Because it's slender and looks like a tendon. So you got semitendinosus, half tendon, if you will. And then after that, you have this more flatter muscle, okay, right here. That is the semimembranosus muscle, which is deeper or more anterior than the semitendinosus muscle, okay? And what nerve innervates all of the posterior thigh muscle, you guys? This is not medial. It's supposed to be posterior. I'm sorry about that. So all posterior thigh muscles are innervated by what nerve? The sciatic nerve. And more specifically, the tibial component of the sciatic nerve, right? So now here is a more, a better view of all of those muscles, guys, okay? Now you have the biceps femoris right here. This is the short head, and the short head has been reflected over onto the sides, cut and reflected. And now you have the biceps femoris short head over here. The long head of the biceps femoris is going to be originate over here. Okay, what is this location over here that we sit on? The ischial tuberosity. Okay, so it's going to be the biceps femoris long head is going to be originate over here, the tibia. The ischial tuberosity, and runs all the way down here. Okay, to the head of the fibula on the side. Okay, on the lateral side, the head of the fibula. Now, the biceps femoris short head is not going to be originate here. It's actually going to be originate on a linea aspera of the femur. And then after that, it runs to the same place, though, the lateral side of the head of the fibula. Okay, and now the semitendinosus right here is going to be this half tendon muscle, aka a more rounded muscle that is going to be more posterior, and the semimembranosus is a more membrane-like muscle, okay, that is going to be deeper or more anterior to the semitendinosus. Okay, so all of this, just like before, is for your own study. Everything here is going to be innervated by the sciatic nerve, but mostly it is the tibial component of the sciatic nerve that is going to innervate all of these 3 muscles: the biceps femoris, the semitendinosus, and the semimembranosus. What artery is going to supply the posterior compartment? Profunda femoris again. Why? Because this is the main artery of the thigh. Remember, guys, when we talk about a femoral artery, really it doesn't really do much in the thigh. It is its branch, the main branch, which is the profunda femoris, that supplies all of the muscles of the anterior thigh, the medial thigh, as well as the posterior thigh. Okay, so this muscle, very, very important. And now I sense there will be a slide that talk. Oh, there's not. So that's fine. Let's talk about superficial veins. So the superficial veins over here, we have many more small veins curved along the medial and lateral aspects of the thigh, and they all drain into the great saphenous vein. Okay, so you have the anterior veins right here from the anterior thigh that drains into the great saphenous vein over here. But you also have these branches here. Okay, so all these branches here that is going to curve back and receive blood from the posterior and medial part of the thigh. And it all also drains into the great saphenous vein. Why is that? Because the great saphenous vein is the vein, the superficial vein that is going to travel superficially in this region. Okay, the lesser saphenous vein terminates within the popliteal fossa way down here. And so when you're onto the thigh, there is only one path that the veins that drains region of the skin around the thigh that is going to go to. It needs to go to the great saphenous vein. Okay? Except for some lower superficial veins on the back of the thigh. Those are going to go down here and join with the small saphenous vein in the popliteal fossa, just like I said before. Sciatic nerve. Whoa, this is very important. The sciatic nerve is the biggest nerve in the human body. And it is actually, do you know that it's actually a combination of two nerves rolled into one? Okay? It's actually a combination of two nerves. Those nerves are going to be the tibial nerve, tib nerve, and the common femoral nerve or common peroneal nerve. You will see it written both ways in textbook. Okay, common femoral or common peroneal nerve. And whenever you guys see those words, you have to know that it is the common femoral nerve. Okay, now the sciatic nerve is a branch of the sacral plexus, and it's going to be L4, L5, S1, 2, and 3. Now, guys, when it comes to the sacral plexus and the lumbar plexus, do not draw it out. You will go insane. Instead, just learn the roots, okay? Like the sciatic nerve is going to be always L4, L5, S1, 2, 3, okay? Tibial nerve is going to be always L4, L5, S1, 2, 3. Common femoral nerve is going to be L4, L5, S1, S2, okay? And if you do that, then you should be good, okay? You don't have to draw it out, okay? It's very, very hard to draw out. It's not like the brachial plexus. That one you can draw out, okay? Now, the sciatic nerve is going to leave the gluteal region and it's descend in the midline of the thigh. But how does it leave the gluteal region? Okay, it leaves the gluteal region by passing inferior to a muscle in the gluteal region. What is that muscle again? The piriformis muscle. Very good. So the piriformis always is going to be a demarcation for the superior portion of the sciatic nerve. Okay, the sciatic nerve is always going to pass through the inferior margin of the piriformis as it goes down into the gluteal region and then in the midline of the posterior thigh. Okay, and it is going to give muscular branches to the long head of the biceps femoris, the semitendinosus, the semimembranosus, and the hamstring part of the adductor magnus. Remember when we talked about the medial thigh, and we said that there is a more posterior part of the adductor magnus that is going to be innervated by something rather than the obturator nerve? Well, here it is. The hamstring part of the adductor magnus is going to be innervated by the sciatic nerve rather than the obturator nerve. Okay. All right. So the cutaneous nerve, we have the medial cutaneous nerve of the thigh on the medial side, posterior cutaneous nerve of the thigh, which is this huge region over here. Huge. Okay, and the lateral cutaneous nerve of the thigh on the lateral side, which is this side right here. So throughout all these lectures, you can basically see one thing. Okay, the anterior cutaneous nerve of the thigh, the lateral cutaneous nerve of the thigh, and the posterior cutaneous nerve of the thigh innervates huge regions, right? But the medial cutaneous nerve of the thigh only innervates a very, very puny region. Okay, so if you need to learn something first, learn posterior, learn lateral, learn anterior, okay? The medial, it's not very that important, okay? But if anything, learn the cutaneous branch of the obturator nerve. That's more important. All right, so now, finally, let's go to the lumbosacral plexus. The lumbosacral plexus is the major nerve supply for the entire lower limb. Just like on the upper limb, we have the brachial plexus. Now, here we have the lumbosacral plexus, okay? So now, the lumbosacral plexus is going to be a combination of two plexuses. Lumbar plexus more superiorly and the sacral plexus more inferiorly. Okay, and the major nerves that we are going to see are going to be branching out from the roots of these nerves. Okay, actually saying them the roots are going to be a little bit misleading because these are not really roots. They're actually anterior rami. Okay, for example, this is the anterior rami of the L1 spinal nerve. Okay, now this is the anterior rami of the L2 spinal nerve, and so on and so forth. Okay, but I'm just going to call them roots simply because of the fact that on the upper limb, on the brachial plexus, these portions are also called the roots. Okay, but they're not really roots. You see, the anterior root and the posterior root of the spinal nerve are going to be something different entirely as you learn about those things later on in the in the nervous system section of our anatomy and or physiology course. So these are anterior rami. Okay, just remember that. So, for example, you have some of the more very, very important nerves that goes out this plexus, like, for example, the obturator nerve over here. What does that make up of? The L2, L3, L4 anterior rami, or the L2, L3, L4 roots. Okay, that's going to make up the obturator nerve. How about femoral nerve? Femoral nerve is going to be made up of L2, L3, and L4. Okay, now how about superior and inferior gluteal nerve? They're going to be L4, L5, S1. Okay, and inferior gluteal nerve, where would that be? L5, S1, and S2. Okay, now how about sciatic nerve? Sciatic nerve is going to be made up of tibial and common fibular nerve. And tibial nerve is going to be L4, L5, S1, 2, 3. Okay, how about common peroneal? Common fibular nerve is going to be L4, L5, S1, S2. So if you learn all of that, you should be good. Okay, learn the roots. Do not draw this thing out. It will drive you insane. Okay, so here it is. This is another one that shows you where these nerves come from. Okay, from the lumbar and sacral plexus, the lumbosacral plexus, as well as where they run into. Like, for example, over here you got what? The obturator nerve. How do you know it without even looking at this? How do you know it? Because it has to pass through what? Obturator foramen, obturator nerve. Boom, there we go. And what are the roots that is going to be making up the obturator nerve? What's that? Let's go back and see. Okay, obturator nerve is going to be L2, L3, L4. So you know that these guys are L2, L3, L4. Okay, L4 should be here. Okay, L2 is here, L3 is here. Okay, L2, L3, L4, making up the obturator nerve going down. See that? And then where does it go to? Anterior branch, posterior branch, and they all go to the medial compartment. See that? This is the beauty of this diagram if you know how to use it. Okay, and you also see that the sciatic nerve is made up of two nerves and is going to go into the posterior region to innervate the posterior compartment of the thigh right here. And you have what? And you also have the femoral nerve. Okay, the femoral nerve right here that goes down, innervates the anterior part of the thigh. Very, very, very good diagram for you to see all of this. All right. And so remember, guys, for the lumbosacral plexus, what do you learn? Do you draw them out? No, you don't. Okay, you learn the roots. Okay, femoral nerve, L2, L3, L4. Obturator nerve, L2, L3, L4. Sciatic nerve, it's going to have tibial nerve and common fibular nerve. And the tibial nerve is going to be L4, L5, S1, 2, 3. And common fibular nerve is going to be L4, L5, S1, S2. Okay, as long as you understand all of this, then you should be golden going forward. Okay, good job. And that is it, guys. That is it for the medial and posterior thigh. This is a very, very short lecture, and I don't think it will take you a lot of time going through all of these two lectures about the thigh at all. Okay? Well, thank you very much for your attention, and I hope to see you in class later on. Thank you. Bye-bye.